Hello, everyone. Welcome. My name is Kambiz Ranavardi, a board member for ColumbiaDC and a graduate of the School of Engineering and Applied Science. We are very privileged to have this evening Damian Paletta and Yasmeen Abutaleb. Damian is economic editor at Washington Post, and Yasmeen, health policy reporter at Washington Post, to talk to us about why and how did COVID-19 bring America to its knees. And our host would be no other than our board member, Laura Biederman. Please allow me to briefly introduce our speakers. I do encourage everyone to check our website for their full bios and the main list of accomplishments. Damian is the economic editor at the Washington Post. He joined the Post in 2017 after spending 11 years as a reporter covering economics, the White House, the Congress, at the Wall Street Journal. His first job in journalism was the Cape Cod Times and has degrees from Boston College and University of Missouri. Yasmeen Abutaleb is a health policy reporter at the Washington Post. She joined the Post in 2019 and was previously at Reuters as a technology reporter before becoming the healthcare reporter based in Washington. Yasmeen has chronicled the White House and administration's response to the coronavirus crisis since January 2020, first covering President Trump and now President Biden. So without further ado, sending to you guys.
Hi, good evening, everyone. I'm Laura Biederman. I'm one of the directors of the Columbia Alumni Association based in DC. Thank you, Yasmeen and Damian, for joining us tonight. I'm so excited to have you here and just go over your book. I'd just like to show it to everyone, Nightmare Scenario Inside the Trump Administration's Response to the Pandemic That Changed History. Yasmeen and Damian, both of you bring your different backgrounds or brought your different backgrounds to this effort. Please tell us how your backgrounds in health policy and in economics, respectively, helped you write this book and put forth such an informative and coherent narrative given your different perspectives in analyzing the administration's response to the pandemic.
Sure. I mean, it's so interesting. Yasmeen and I had only known each other a few months, and and we were actually working on a story together that was about hospitals in Georgia when the pandemic kind of began in January. I think we realized something was going on. Started writing stories in February. Things got even worse, especially in the end of February. And so Yasmeen and I were kind of in the middle of the story, but from much different vantage points. First of all, she was a reporter, I was an editor. She was on the health team, I was on the economics team. At the time, it was really a health and economics story because no one knew what was going on. The White House health team was scrambling, and the White House economics team was scrambling. And so I think it made us really compatible out of the gate. And Yasmeen approached me about doing this project. I think a few months later. At the time in April, if you remember, the stock market had fallen like 10,000 points, and it was kind of rebounding at that point, but the virus was really spreading out of control. And we felt like we just had a really, we had a perspective that no one else had. I mean, obviously there's lots of books being written all the time by journalists in Washington, but we came at this from kind of a policy perspective, which gave us access to different people inside the White House, because they knew this wasn't going to be a horse race book. It was going to be a book about substance and really tough decisions. And so I think that gave us a kind of an easier way in. Obviously, kind of got chaotic from there, but that was our initial premise. Does that sound right, Yasmeen?
Yeah, and I'll just note that we hadn't known each other that long, but when the crisis was starting to unfold in January, Damian was actually editing all the stories about the chaos. So we were in the hot seat together pretty early on, starting with the WHO decision when they were having these debates in early January or mid-January about whether to declare it a public health emergency. And then we covered the weekend of the travel ban. The China travel ban was really crazy. And then we realized, this was really going to be a different story. And all our sort of preconceived notions about how the year was going to go or the other project we were going to do were just not really relevant anymore. And it just sort of continued from there. And then I think for a little while, they sort of diverged into there was a very clear health story, and then there was a very clear econ story. And the two teams weren't really working together anymore. So you had like the econ path, and then you had the health path and the public health measures that they were taking. But I think, like Damian said, because of that, it made sense for us to come together to write the book. But it's not a pairing most people would have thought of. Like when we were doing all the interviews this summer, when the book came out, apparently a bunch of my uncles and stuff were asking my parents, like, how did they come together? This is like, it works. It weirdly works, but this is such an odd pairing. I would have never thought of it.
Well, the book comes across as very holistic. So for you to say that it seems like an odd pairing, I actually found it a really sort of holistic look and a breakdown of what transpired. So I'm interested. I'm interested to hear sort of, thank you for sharing like how you found each other and how you sort of came up with this. I'd be interested to, I mean, you probably didn't start off as friends. I'm assuming that you're pretty good friends now, having, been through maybe like the crucible, but I'd be interested to hear about what you learned from each other and about each other throughout the whole process.
Yeah, I mean, we're first-time authors. We've written between us thousands of stories, but this is a whole different experience. And I think that, to be completely honest, like, I think 2020 for us was a lot of highs and lows, just like it was for everybody else. This wasn't a book we worked on for 2 hours, then we went out to like the clubs. You know what I mean? Like, this is a book we worked on, then we went to the grocery store and there was no food. Or this is a book we worked on and then we had to go get my kids tested, or her parents like were kind of hunkered down waiting for vaccines. Like, this is a book that was about our lives. And so, having a partner like Yasmeen, I think we could not have gotten through it if we didn't get through it together. And there were times when I like needed her to pick me up, and times when I needed her to come in behind me and like make sense of what I was writing that was really confusing. And I would ask her tough questions about a section, and she knew that she could ask me tough questions too, because I think we knew that the only way we were going to get through this is if we were like brutally honest with each other. And we kind of crossed the finish line, I think, with that mindset.
Yeah, I think, I mean, for me, Damian's an editor and has a lot more experience than I do. So I obviously had a ton to learn from him. And he was the stronger writer. So, I cover health policy, which can be kind of dry sometimes. Damian's really good at like spicing things up, making it a narrative, making it engaging. I think the final product kind of reads like a thriller, which is not like my natural inclination. Like, I could get really, really far in the weeds, like on the testing chapter. And Damian was like, people do not need to know this much about testing. Like, you're going to lose people here. And, vice versa on some economic stuff or whatever. Like, when you're so deeply entrenched in your beat, you feel like people need to know everything. And I mean, the truth is they probably only need to know like 20% of what you know about a certain issue. And then I think we just trusted each other. Like, we would sort of start when we were on book leave, especially, we would say like, I'm going to do this chapter this week and you're going to do this chapter this week. And then by the end of the week, we'd swap chapters and sort of edit and rewrite through each other sometimes. And I think that takes a certain level of trust to let someone go through your work that way, to trust that they're going to make it better, to not get really sensitive and defensive about it. So I think I can speak for myself. I feel like I really lucked out in having such a great partner and someone who I trusted and who seemed, trusted my opinion as well. And it was a partnership. There wasn't like one person who was domineering over the other. And we were on such an intense deadline and we were covering such a crazy story. Like, it was a really emotionally trying story to cover. And even when we were covering it in real time last year, there's this element of a journalist where you recognize something as a great story. If something crazy happens in a meeting or you get some really great nugget. But last year, when you would find, or when we were reporting the book, which is when we found out so much more and we found out it was, even worse than what we were reporting in real time, there was this element of finding out that things were totally chaotic, or Trump was pressuring the FDA, or they had authorized this drug that really had no evidence for use, or there weren't enough tests. Like, they were things we were all experiencing in our lives, and we were all scared and living in fear for so long. So I think those meetings, while they might sound like juicy nuggets, just took on like a different level of importance because they really did have life or death consequences. And I think that would have been really lonely, doing that all, alone.
Mm-hmm. Well, I will say, as I was reading the book, I was trying very hard to see if I could find Damian's writing versus, yours. And to your credit, or maybe my ignorance, I really couldn't. The book kind of flowed very seamlessly, and it did read much like I don't want to say a novel, but it was super readable and very, very engaging. And I was really impressed with your behind the scenes reporting. What you were just talking about, sort of living through the fear, kind of dovetails into my next question. Is I think what is so interesting about this book and your writing of it is that you were writing about a dynamic situation that unfolded every day. And just like the rest of us, you were living through the pandemic, experiencing the ups and the downs and the closures and the fear and the trauma and the changes just to our daily rhythms. What was it like for you personally? And I know, Yasmeen, you just spoke a little bit about it, but what was it like for you both personally, writing the book and then also watching the carnage in a way, how, and just the changes to our lives and the people losing their jobs. What was that like for you?
I mean, that's it's a really great question, and I think sometimes I don't think about it enough because I don't want to think about it. But I mean, I'll never forget. June of the 2020, my daughter had to go in to get some dental work, and the next day we get a call from the dentist saying, the person who was treating her has COVID. And then like that feeling as a parent, of waiting for tests, the testing system isn't fixed. Like that waiting is just so stressful. And I think, and I also quite frankly think that it became clear that there were so many political decisions being made that were not in the best interest of certain people, and that people were dying unnecessarily. I think we felt like even more dug in to get this right. I mean, we had some tough interviews for this book with people who gave us conflicting accounts or false information. And, we tried to be really fair in the book, but we also didn't pull any punches because we felt like we owed it to all the people whose lives were disrupted or ended to get this right. And so, I think as we got closer, especially that final surge in the winter, that was just devastating. We really just kind of buckled down, and we worked really closely with our editor, who's amazing at HarperCollins, to just really, make it tight, but make it like really honest.
Yasmeen,
yeah, I mean, yeah, I will just note that when we were on book leave, which was New Year's through the end of March, was when we were in that really deadly winter surge. So that was, I mean, and I think it was awful, but I think we really understood the importance of getting this right. And even though we knew the pandemic wasn't going to be over by the time our book came out, that, the first year, the Trump administration response had laid the groundwork for, why the pandemic had become so disastrous. And I think in the future, people are going to study the Trump administration response and the Biden response differently. They also handled really different phases of the pandemic because obviously Biden came into office and there were like 2 vaccines that were ready to be rolled out. But it was hard. I mean, at that point, 3,000 or 4,000 people a day were dying. We literally couldn't leave our houses. Like I remember that was the month and a half or something where like we wouldn't even go to the grocery store because things were so bad. People were ordering their groceries and stuff. And like Damian said, it was so frustrating, especially towards the end when we were fact checking, that for something so important, people were still trying to settle political scores. They were still trying to sort of knife their adversaries, and they saw the books as like good avenues to do that. And we really were, I mean, I think this was the advantage of being beat reporters. We understood everyone's agenda. We understood who didn't like who and the things that they tried to leak in the media all the time. But, you would have these moments where you're like, really, like, don't you think you owe it to people to just be honest about what happened? And I cannot tell you the number of people who claimed Operation Warp Speed was their idea and that they were really the ones who brought the vaccine to the finish line. And I remember at the very, very end, I think we were like 2 weeks from submitting the final manuscript, sort of fact checked. we had this anecdote in there from someone, and we checked with another person who was in the anecdote, and they were like, that did not happen at all. That whole conversation just never even happened. And we were like, oh my God, what do we do about this? Like, what do we do? And it wasn't important enough, so we ended up just cutting the whole thing. But like, that was the process in trying to sort out what happened in these meetings. Like, we really didn't take it lightly in trying to reconstruct how all of this came to be.
Well, so Damian, you mentioned just briefly that you endured some tough interviews. Can you,
Yes.
you elaborate, sort of maybe give us a little tidbit?
Well, sure. I mean, there was one interview where Yasmeen and I did together. We did many interviews together. And there was one interview that we did together. I won't give the person's name, but the person was being such a jerk that I said, okay, this isn't going anywhere. Forget it. We're done. And the person sent us an email the next day apologizing. I mean, this is someone who's like very famous, and sent us a note the next day apologizing. And then there was another interview where, quite frankly, I was brought to tears. I mean, it was just so gut-wrenching, the story, this really unexpected story that another really famous person told us about their personal life. And I think one of the things we tried to do in this book, hopefully we succeeded, was there's all these two-dimensional characters that we all saw last year. Fauci, Birx, all these people. And you saw them on TV, you know a little bit about their story, but they were just kind of these talking heads, these bullet points. And we really felt like these people deserved like a three-dimensional portrait, you know, with their flaws, with their whole backstory, because you can only really understand Debbie Birx and what she went through if you know what her life is like. You know, if you know that she almost got a blood transfusion with blood that was tainted with AIDS when she was having her first kid, or if you knew that Fauci used to deliver medicine for his parents' pharmacy on his bicycle through Brooklyn, like this only makes sense. Like all these people converged into this one crazy year, but they have all this kind of baggage. And so we really went out of our way, I think, to do everything we could to bring these people to life for readers in a way that preserves their legacy, because we felt like their backstories, I mean, some of these people, like Dr. Birx, people revile her. I mean, there's some people that just revile her, and they have no idea. You know, she made some mistakes, for sure. And you know, she might not admit it, but she, you know, she did what she did because she thought she was doing the right thing. But her path from point A to where she ended up, you know, is extraordinary. And, you know, I think Yasmeen and I felt, and we tried to make this clear in the book, that the way she navigated the White House in those first few months probably saved thousands of lives. You know, she kind of brilliantly convinced the president that she kind of had his back, and the advice that she was giving him was in his best interest, and he bought into that in those big, you know, moments in kind of late March, and it, you know, when he decided to extend the shutdown, and in a way that Fauci never did. Fauci was kind of like, you know, wanted to kind of stand defiantly, and so I thought we just felt like people never really figured her out, so we needed to like make her come to life a bit. And so I think it was a lot of we spent a lot of time doing interviews with people and people who knew people to try to get their story straight. And then, you know, we knew that we were going to get pushback. We knew that there were some characters, obviously people had very strong feelings about Dr. Fauci too. Like we knew that people were just not going to accept the portrait of these people that we painted, but we, you know, as journalists felt like we kind of owed it to everyone to get this and get it right.
Yeah, that makes sense. And I actually very much appreciated learning more about Deborah Birx. Okay, so I have another question. One of the interesting things that you did in the book was to organize the book chronologically, which makes sense, but at the top of every chapter, or when the chapter begins, you would start the chapter with the number of confirmed cases at that time and the death count. Why did you decide to do that? And then just for me personally, I feel like doing that really drove home the real world consequences of the chaos that was going on kind of behind the scenes.
Well, I mean, that was Damian's idea, but I think we did it for exactly the reason that you laid out, that there are some anecdotes in the book that I think are kind of darkly funny. There's this meeting in early August where everyone's sitting and they think that it's going to be for a task force meeting, and then they're ordered up to the Oval Office, and Trump basically just wants to rip into them one by one. And he tells Birx, every time you talk, I get depressed. He tells Fauci, I spend half my day responding to what Anthony Fauci has to say, and I'm the president of the United States. He tells people they're being too negative. And that chapter starts with the death count. And by August, I think around 150,000 people had died. And so I think you read that anecdote on its own, and it's kind of amusing, but you see what the consequences are. And I think especially when you get to like the emergence of Scott Atlas, and he's advocating this herd immunity strategy of just like, let it rip. It's going to run through people and then we'll get to herd immunity. I think it was important for people to understand what the stakes were at that time. And I think some of the discussions and some of the decisions that they're making come off as especially tone deaf or not attuned to the reality of the situation. Like when Trump starts going out and doing campaign rallies, when you see how quickly the death toll is climbing up at that point in time. And I think also, our book doesn't cover a super long time period. It's like a 10-month time period. Mm-hmm. And you see, we start in January, there's no cases in the US, no confirmed cases in the US, there's no deaths. It takes until February, late February, for there to be the first confirmed deaths. And by the end of the book, which is right after the election, you're already at almost 300,000 deaths. And so I think it was really important because, the chapters almost go month by month, to see how quickly it was escalating and just how dire the action or inaction they were taking was, or this obsession with seizing on miracle cures. Like, I think it just shows how disconnected from the reality they were sometimes, or, in the summer when they're having a debate about masks and pretty much everyone wants Trump to embrace masks except his then chief of staff, Mark Meadows. And in July, at that point, we've surpassed 100,000 deaths. So I think those numbers just drive home what these individual anecdotes mean, which might not mean a whole lot in a vacuum.
Understood. Damian, did you have anything to add?
Yeah, I would just say that we, like Yasmeen said, we wanted it to almost serve like mile markers, like just a constant reminder as you were in the White House, kind of witnessing the chaos, exactly like she said, what was happening outside was catastrophic, and there were consequences to a lot of these actions. And so we wanted, in kind of a sharp, direct, consistent way to keep that going throughout the book.
Okay, and I guess leading into that, I think what was so painfully obvious to so many people watching the administration's response was just how disorganized they were, and you could watch that play out in real time in the media and with their press statements. And just reading the book, it just seemed like it was exponentially worse behind the scenes. There was backstabbing and shouting and people undermining each other, Jared's shadow task force chaos. Can you talk a little bit about what you discovered about the administration's response and who was in charge, who was not in charge? I mean, why did we not ultimately get a coherent national response?
I mean, I think it's a tragedy. It's one of the great tragedies of American history. I think the lack of trust is the biggest issue. These people, at the beginning of the book, we go into great detail about Alex Azar, the head of the Department of Health and Human Services, and how he was like barely hanging on to his job. People were gunning for him. And so he had like almost no credibility at the beginning. And when you have HHS secretary during a pandemic who everyone's already got their knives out for, and there was kind of backstabbing just as the process got started and no one trusted each other, things only got worse. I mean, I would just also add that, when we were talking to people real time who were involved in this, and they were painting portraits and pictures of things that were way worse than what the public was seeing, we knew that, they weren't even trying to pretend, oh, the media's making it worse than it is. We're actually all getting along great. We have all these plans, very organized. No, it was way worse than it seemed at the time. And so I think the fact that they were, trying to take each other down to the media, who knows how bad it actually got in the Situation Room, but it was really, really nasty, and it only got worse as the year went on.
I think also the president didn't empower anyone to be in charge of the response. And that was a really big thing. And that was completely deliberate. He really didn't want anyone to be in charge. And I think now we have two White Houses to kind of compare. And, you know, the Biden administration by no means has a perfect response. They've fallen short on a number of areas. But, you know, Jeff Zients is the White House coronavirus response coordinator, and he is in charge. It's very clear that he is in charge, and the decisions flow up through him. And it's clear, you know, what role the agencies play. And that doesn't mean that things run seamlessly, and it's a fast moving situation. You know, the Delta variant caught them off guard, but there are clear lines of communication and clear lines of command than there were in the Trump administration. I mean, by the time we got around to March or April, you had, you know, Alex Azar had been the head until the end of February. And then he gets kind of unceremoniously replaced by Mike Pence. And then Mike Pence doesn't really have a health background. So he brings in Deborah Birx as his, you know, White House coronavirus response coordinator. And he says that she's going to be like his right arm and she's going to be calling the shots. And that's what she thinks is going to happen too. But then Jared Kushner comes in and he decides he needs to set up his own task force because he thinks the White House task force is inept and not getting anything done. And, you know, he thinks he gets frustrated by government red tape, some of which is valid, some of which is there for a reason. So you don't break federal contracting laws or overpay for things. And so it was almost like you could pick your path. If you were in the administration, there were people who were like, I want to be on Jared's team because Jared has the ear of the president and he's going to get stuff done and he can call up a governor and get them ventilators. And so some people gravitate towards there. Some people can't stand him and want to, you know, align themselves with Mike Pence. The doctors all want to listen to Deborah Birx because they feel like she knows what she's doing. So you can't run a response that way. Like you're not going to have, and so like they never had a national testing strategy. They never had a national supply strategy. There were all these really horrible supply shortages of basic things like masks and gowns and gloves. No one's coordinating where to send them. And so states are just competing against each other to get them. But you need to have clear chains of command, and Trump, in all aspects of his presidency, very deliberately never wanted someone to be fully empowered.
So maybe I'm jumping ahead a little bit, but while we're on the topic of the current administration, how do you feel the Biden administration is handling all of this?
Well, I mean, I think they got off to a strong start with the vaccine, and but then they, for whatever reason, kind of overpromised. And it's funny, you know, well, it's not funny, it's terrible. Our book was, we knew our book was coming out June 29th, and President Biden had said that on the 4th of July, you know, we'll be able to have barbecues and parties together. And so, you know, Yasmeen and I are hearing, okay, our book comes out, then it's the 4th of July. So like, it's kind of, COVID's over. And, you know, they clearly wanted to make people think that we were turning the corner. And I think, you know, I was just looking at data today, quite frankly, of like restaurant reservations. And in June and July, they were back. I mean, the country was back. And then that Delta variant came in, which no one saw coming. Although maybe we should have seen it coming because the virus was like really ravaging India and moving through the UK. But the Delta variant came back and just really, you know, cold-cocked the Biden White House. And I think they lost a lot of credibility with that. You know, they clearly were over-promising. And so I think they've been struggling since then. I mean, still, you know, you can't go into CVS and get a take-home test box, like they're gone. And yeah. A lot of these supply chain and production issues that Yasmeen was just talking about remain an issue to this day. You know, and I think the other thing that, and this is a legacy of last year, but you know, when after George Floyd was murdered on Memorial Day, and the country like cleaved in two. And everything became really political. And, you know, some states were reopening and some weren't. And some people thought hydroxychloroquine was this savior, and some thought it was kooky. You know, then we got into the situation this year where the country, a lot of people don't trust Dr. Fauci, or they don't trust what the White House is saying might be political. And that really, you know, made the vaccine discussion very polarizing. And so then there were just some people who flatly thought that even though President Trump played a big role in helping get it developed, that the vaccine was kind of a scam and that it was, microchips and this and that. And I think it was really hard for the Biden folks to come to grips with the fact that they needed a different message or a different messenger to try to convince a lot of people that the vaccine would help them. And so, there obviously a tremendous number of people have died of COVID during the Biden administration, and they're people that the Biden White House has tried to connect with, and the vast majority of them are not vaccinated, even though they could have been. But I think that's going to be something that, is going to be part of his, legacy.
Yeah, I think Damian hit on a lot of important points. I think probably their biggest shortcoming, other than the overconfidence that they could, kind of vaccinate their way out of the problem, which I don't think was an unreasonable belief, when they came into office. People forget this, but the FDA's initial bar for the vaccines was that they had to be more than 50% effective. And that would be considered a huge success given the timeline these were delivered on and just the lethality of COVID. And then the first one was Pfizer, and it was 90 to 95% effective. And then Moderna came out a week later, and it was also 90 to 95% effective. And then poor J&J comes in and is 80%, and people are turning their nose up at that. But the vaccines really exceeded people's expectations. And one of the other shortcomings was that the US just wasn't doing a ton of genetic surveillance of the virus. So we didn't have a really great understanding of how it was mutating and which strains were dominant and how quickly new strains were taking over. And so, like Damian said, when the 4th of July rolled around, cases were at a record low. We were at under 12,000 cases a day, which was insane given that we were at 400,000 a day when Biden took office. And he gives this speech and says, now we're going to have freedom from the virus. And we later reported his medical advisors were like, please don't say that, because the Delta variant is ripping through India and it's ripping through the UK and it's ripped through Israel, and they have really high vaccination rates. So it's probably coming here. But there's always this sense that things that happen overseas aren't going to happen in the US for whatever reason, even though at every step of this pandemic, things have played out overseas and then they've come here. We have not been immune from anything. And Damian raised the testing issue, and because they thought they could vaccinate their way out of the problem, they kind of dropped the ball on testing. They thought what we had was sufficient and didn't make a lot of investments in it. So, I think it's sort of a testament to how difficult a problem this is to solve. We documented the Trump administration response, and there were a ton of forced errors there and things that would have made a big difference. 400,000 people did not need to die in the first year of this pandemic. I think there's a pretty widespread consensus that with better messaging on masks and more consistent federal messaging on social distancing and all these things, you probably could have saved, a couple 100,000 lives. But it's not like it would have been over in 6 months with a different president. This is a pretty intractable problem. Every country's struggling with it to varying degrees. And I was joking with a colleague the other day, there's always one country at various points in time, people they're doing it right, we should really learn from them. And then a month later, they're completely screwing up and they're a case study and a warning sign. So it's a really difficult problem, but it's important to understand what decisions everyone has made so you can at least learn from them. And I hope the book provides some pretty clear lessons on, where things obviously went wrong and where it would always make sense to make a different decision in that circumstance.
Thank you. So I learned a lot about the doctors, Dr. Birx and Dr. Fauci, and I thought that was wonderful. Can you talk a little bit about their relationship with each other? And then maybe, can we get into Trump's relationship with Fauci? Just talk about that a little bit.
Yeah, Yasmeen, why don't you start on this one?
Okay, well, I'll talk about Trump's relationship with Fauci, and then you take the other part of the question. So that relationship has a weird evolution because, Fauci, Trump is his 6th president, and he's never met him before COVID started. I think he was supposed to meet him one time in 2019 after an Ebola trip, and Trump really to West Africa, Trump didn't really have a ton of interest in it, and so he canceled the meeting. So the first time Fauci meets him is when they start dealing with COVID in January and February. And at first they kind of have this weird bond because they're both like in their 70s. They both grew up in New York. They both have a kind of similar affect in certain ways. And so if you watch the early press conferences with the task force, they're kind of ribbing each other, and Trump's kind of like making lighthearted jokes about his height and the fact that he wanted to be a basketball player. And so it seems like it's kind of an unlikely pairing in the beginning, but then it pretty quickly sours, because there is nothing that Trump hates more than being overtaken or someone stealing the spotlight from him. And in fact, like, he gets jealous of Mike Pence in the first few weeks when Pence is running the briefings and his approval ratings are really high and the administration's approval ratings are at the highest they've ever been. And then Trump decides to take over the briefings and they kind of fly off the rails from there. So when Fauci starts getting a ton of media attention, because it seemed subtle at the time, but when you go back and look at it in retrospect, it's kind of striking. I remember there was one press conference where the hydroxychloroquine debate had started emerging and Trump was touting it and tweeting about it. The FDA was about to authorize it, even though there wasn't really any evidence that it worked. And I think a reporter at the press conference asks, is there any evidence that hydroxychloroquine works? And Fauci, unlike the other doctors, doesn't hedge it in any way. He goes up to the mic and he's like, no, there's no evidence it works. There's absolutely no evidence it works. And him and Trump do this really weird rotation where like Fauci goes and says no. And then Trump goes in front of him and is like, I think it's great. And then Fauci goes back in front of him and is like, there's really no scientific evidence it works. And they just keep doing this back and forth for a couple of minutes. No one else was willing to challenge Trump so publicly in that way, or even really privately. Like, they always tried to sort of massage his feelings. And the point where the relationships, I think, reaches the point of no return is in the summer. I remember my colleagues and I were doing a story on how the relationship between them had deteriorated. This was like in early July. And when we asked the White House for comment, they had sent that opposition list on Fauci. Like, we expected them to send a sort of canned statement of, oh, sometimes they have disagreements, but they're on the same team, like you sort of generally do with these palace intrigue stories. And instead they sent this list of a dozen times Fauci had been wrong, and this is why the president couldn't trust him anymore. And then they circulate the list to all media. And that's the point at which, like, Fauci knows his relationship with the White House is broken. He's not going to repair it with the president. He rarely meets with him anymore after that. And then you see the president start to really publicly go after him. Like, he's convinced that Fauci's going to cost him the election. And I think a lot of the right-wing animosity that you see at Fauci now is because a lot of people firmly believe that he cost Trump the election. So that's sort of the arc of their relationship and how it falls apart. And Fauci's a career official. He knows he's not going to get fired. The other doctors are not in that position. And he feels like it's his responsibility to continue to speak up. He tries to weigh his decisions carefully, but he continues to do it, through the election. And that really angers the president and his aides.
Yeah, and so I would just add to that. There are really four main doctors in the book: Fauci, Birx, Redfield, and Hahn. Redfield from the CDC and Steve Hahn from the FDA. And obviously, the Birx and Fauci, relationship is so interesting because they worked together at Walter Reed during AIDS. Actually, Redfield did as well with them. So Birx and Fauci are close, but there was this like obvious tension between them during COVID. Like, they definitely had each other's back and they had, kind of an understanding. But I think, and Fauci, had the benefit of being unfireable because he was a civil servant. He wasn't a political appointee, whereas Dr. Birx could be fired at a moment's notice. And her office was like in the White House. So she had like nowhere to hide. So, whereas Fauci could kind of easily go on TV and say wherever he wanted and challenge the president, Dr. Birx just didn't have that luxury. And, I think, to be, candid, I think he was treated differently than her, by the media. We knew that he had death threats, and, our book opens with an event where he opens an envelope in his office and there's like powder that explodes all over him. And there was a lot of coverage of him getting death threats and how he had a security detail, but no one knew that she also had death threats and got letters sent to her home that she should kill herself. And, she was kind of going through so much psychological torture and, was actually literally sick to her stomach. She would come into the White House because COVID was everywhere in the White House, like literally everywhere. And so she was going through all that, getting, just pummeled by the media, by Nancy Pelosi and others. And, no one kind of got where she was coming from. But he, turned in, there was like candles made of him and bobblehead dolls, and he, socks and stuff and donuts. And he became this kind of cult figure, whereas she was just seen much differently. Now, he made, Dr. Fauci, made mistakes early on when he said we don't need to wear masks, and he'll kind of have to live with the legacy of that forever. And she, publicly kind of praised President Trump's ability to understand COVID data, when I think that was an overstatement. So, they both kind of made miscalculations, but I think her, obviously she was kind of let go essentially as soon as the President Biden came in, whereas Dr. Fauci is going to continue to stay in office. So I think their kind of weird relationship and that tension between them is something that we just found kind of fascinating, and we wanted to try to, bring to life.
Mm-hmm. Let's talk about Trump getting COVID. I think there were a lot of people who prayed that after he got COVID, things would be different. I certainly kind of expected that it would be. Was this an inflection point for the administration? And why do you think it was not a wake-up call to President Trump to take the virus more seriously? I will never forget that drive that he took around Walter Reed, and then the, coming back to the White House. I guess, will you talk a little bit about that?
His Evita moment coming back to the White House. I think, Damian and I were really surprised when we were reporting out that weekend to find that, I think when we were reporting it, we thought it maybe would be an inflection point, but the way that they were dealing with it was so haphazard. Like, no one knew what the precautions were in the White House. No one knew if everyone was supposed to get tested or be home or be there. Like, no one knew what was happening that week, and they weren't contact tracing the event. So I think as reporters, we were pretty skeptical anything was going to change, because we were like, it's not like they've suddenly gotten it together and are organized because the president is sick. But I think we were surprised when we were reporting it for the book that a lot of people, including the doctors, thought this was going to be a turning point. And I'm not sure why they thought that, like nothing had been a turning point, but I guess they thought that he got sick, he almost died. There is no way this is not going to be a wake-up call for him, and he's finally going to understand firsthand how serious the virus is. But I actually think the fact that the White House was able to pull such extraordinary strings for him to get him access to the monoclonal antibody, which works really well. Fortunately, at the time it wasn't approved, so they had to get it through a compassionate use authorization from the FDA. They called the FDA commissioner directly to get this. They want him to cut corners to get it for the president in a matter of hours. They declined to do that, but they get it for him pretty quickly. He gets literally every drug that has any proven efficacy, not hydroxychloroquine, but any drug that has any proven efficacy against COVID at that time. And if you remember, almost all of them were in massive shortages. Like remdesivir helped with hospitalized patients. It was really hard to get access to. Only a few hospitals had access to it because there just wasn't that much of the drug. There was dexamethasone, which hospitals generally have because it's a steroid, so he got access to that. And then he gets access to the monoclonal antibody, which I think at the time only 10 people had gotten access to outside of the clinical trials. But I actually think because that drug helps him turn around so quickly, that Friday, they fear he's going to be put on a ventilator, and they send him to Walter Reed. They have to really convince him to go to Walter Reed. He didn't want to go. And the White House said it was just a precaution. But, now we know from our reporting that people were telling him, like, you can either go now when you can walk out on your own, or you can be taken out by the Secret Service or in a wheelchair, and people are really going to know that you're sick. But the drug gives him such a quick turnaround that I think he thinks COVID is not that serious. Like, he was really sick and now suddenly he's feeling much better. And he didn't seem to put together or want to put together that this is not a drug people have access to right now. And in fact, through the duration of his term, people really don't have access to that drug. It gets authorized, but they don't do a good job on the distribution, so people can't really access it. So I think that just gave him like this sense, and so many people had gotten sick in the White House and had sort of the equivalent of a flu and gotten better. Like we talked to White House officials who got infected and they were like, I don't understand what the big deal is. Like I had a headache and a cough for a few days and now I'm fine. I was working through the whole thing. So I think that gave them the sense that this was just not as big a deal as people were making it. And I think they had this sense that it was affecting the elderly and generally everyone else was fine, which I think is politically easier to live with than if it were like killing lots of young people.
Mm-hmm.
Yeah, I often wonder if things would have been different if, the first 100,000 people to die were not in their 70s and 80s. Anyway, I'm sorry, Damian, go ahead.
No, I was just going to add, I mean, I actually think that weekend was a turning point. I think we turned as a country right headfirst into the virus because he came out and said, don't fear it. So many people did what he said. And if you look at the data, that third wave took off right then. I mean, that was really when the winter wave began, was at the beginning of October. And it went right through the election and just kept going and going and going. So, I mean, I think it was kind of like he was at a fork in the road. We as a country were at a fork in the road that weekend. I mean, I'll never forget watching him walk across the South Lawn. It was, I think for me, like watching the original moon landing. I mean, it was just a moment I'll never forget the rest of my life. We didn't know if we would ever see him again. I mean, and he was, overweight in his 70s and he had COVID and it was clearly in his lungs. I mean, he could have easily died. And so I think when he, as Yasmeen said, he gets the monoclonal antibody, it's a miracle that he's essentially saved. And then he kind of tells the country, listen, don't fear the virus. I beat it. We can beat it, which is a hopeful message. But it just sent a message to so many people that, you don't need to be afraid. Don't put a mask on. And then the virus just kind of, rampaged the country from there on out.
Right. I do feel like, when he came back to the White House and he took the mask off and you could just see him sort of gasping, I was just like, our country's breaking, and then maybe another time when I remember feeling that way was, the Liberate Michigan, all that. I felt we were just further sort of breaking. We're getting close to kind of the halfway point, and I know that some people have some questions. So I have a couple more questions for you, and then we'll get to audience Q&A. I think one question I have for you is just first of all, Damian, when you told me you were writing the book a year ago, I in the very back of my mind, I thought, well, the book isn't coming out until next year. It's probably not even going to be relevant. And I mean, sadly, no, I'm sorry, but sadly, no, I knew it was going to be great, but I did sort of wonder where we would be as a country I assumed we would be through, we would be done, and it would be, your book would be a historical book, and we're not close to done. And I guess, given what you've learned, in your research, is there one thing that if you could go back in time and change, like what would you change to make this better? What would you change?
Well, I mean, I think what really sabotaged the response was having people say things definitively from the get-go that ended up not being true. And that includes Fauci and Trump and others. And so and I know it's hard, they were kind of dealing with initially the information they had at the time. They were worried that, quite frankly, that hospitals were going to run out of masks. And you can understand where they're coming from. The last thing we need is doctors and nurses dying, and then no one can take care of all these sick patients. So let's just tell people to cool it on the masks. And that sent a signal to people. And then they changed their tune. And what are you talking about? Is it masks, no masks? And do we wear bandanas? And I think that all that confusion and sort of pick your own scientist, mentality that the country did, I think just made it impossible for them to get things sorted out. I just feel like they lost so much time. I mean, Yasmeen and I spend a lot of time going over, as she mentioned initially, on this testing section of the book, where the CDC botched the initial tests. If you don't know who's sick with a virus that spreads among people who don't have symptoms, then you can't stop it. And the fact that they lost those like 3 or 4 precious weeks in February, I think those are weeks that we'll never get back. And I mean, obviously, listen, the virus, few countries escaped, and it was just a horrible thing. It's something I think in the scope of modern human history, this is one of the nastiest, deadliest things, because it's just a silent killer. Like, it was like a fog that kind of washed over the country. But the fact that it became so political so quick and there was so much misinformation, I think that just made it impossible for us to navigate it.
Yasmeen, do you have any thoughts?
Yeah, I think there are a lot of things. There are a lot of people who think testing was the original sin, because like Damian said, that the month of February would have been the time to, I don't know that you would have crushed it, but you could have had a much earlier response before it spread out of control. Once it's spread out of control, it's too late. But I think the thing that probably would have made the biggest difference is if there had just been a consistent message on masks from the very beginning. And like Damian said, it's understandable that they were trying to conserve masks in the beginning. They really didn't understand how well they worked. The thought among some of the doctors in the administration was that people in Asia wear masks fairly regularly and they don't have significantly lower rates of flu than we do. So is like a cloth mask, or a non-N95 mask really going to do anything? And it took a couple studies and until about mid-March for them to realize like, oh, it did actually make a pretty big difference. So, the science is complicated, it evolves, you learn over time, but I think you need political officials who are willing to accept that the science changes and that they need to adjust to that and to say, and I think the doctors could have also had a mea culpa and said, like, we didn't fully understand this, science is constantly changing, but now we really recommend masks because this is what we thought and this is what we've since found out. And that kind of conversation just never happened. And you had such conflicting messages on masks. And I feel like if from March on, everyone had just coalesced around the idea that this was effective and everyone should wear them, that it really could have made a big difference. And it could have been a non-political issue like it was in a lot of countries.
Right. So my last question is, how do we learn from this? How do we go forward? Because this is apparently going to be endemic. How do we move forward? The death toll is staggering, but if you can end at least my portion of the discussion on a positive note, I think we would all appreciate that.
Yeah, so I think there's a lot of positive things that we have to take away from this. I mean, obviously, to learn from this, I think the most important thing is to have people in power, in positions of power that are cool under fire, that can be straight with the American public, and that have expertise. They're not kind of political hacks, people who are kind of ready for the big moment. But I think we also have to remind ourselves about all the heroes, the teachers, the doctors and nurses, the ambulance drivers, the grocery store workers. I mean, there were some people, some of whom were making $10, $12 an hour, who just did incredible service to their fellow citizens. And I think, their names aren't going to be in the paper, and a lot of them died. And and what teachers went through last year, and still to this day, what they go through, I think would never be appreciated. They did not get taught how to do what they're doing, and they just kept doing it. So I think we should just kind of almost take solace in the kind of power of the American spirit. It was a horrible chapter in American history, and our book does not have a happy ending. Okay, but we're coming out the other end of it, we pray, with a firmer understanding of what we're capable of. I think a lot of us have a firmer understanding of what's important to us, and also kind of we know that there's consequences in leadership, and you're right. This virus is gonna be around. There's gonna be another pandemic, but now we kind of know what not to do, and whether our leaders, follow that course, I guess we'll see.
Yes.
Well, one of my colleagues and I are working on this story right now on how the pandemic ends and when it ends. So I think the Delta wave especially taught people to not be overconfident and to not make too many predictions. But I think the good news is we're generally heading in the right direction. We seem to have peaked and are coming down. The US vaccination rate is getting pretty high. I think it's at 76% among people who are eligible. You're always going to have a contingent of holdouts, but hopefully, that gap will close a little bit more over the next couple of months, whether it's through mandates or people hearing from people they trust or whatever it is. And I think, the goal is to live with COVID the way we live with flu. And the difference is COVID is not seasonal, so it's not going to be seasonal the way flu is. But the goal for health officials is to get it to a point where we're out of, the pandemic phase, which is what we're in right now, because we're still at around 90 or 100,000 cases a day, get it more to around like 10,000 cases a day, which we did get to over the summer. And that when people get infected, it's not a death sentence, which the vaccines actually do very effectively. So I think there's a lot to be hopeful about. I don't think things are going to be like this forever. And it does feel like there is hope that things will dramatically improve over the next few months, especially once we get out of the winter and we're not also dealing with flu and other respiratory viruses on top of it. And COVID cases will happen. People will get infections even if they're vaccinated. But for the most part, they're mild or they're asymptomatic. They pretty rarely result in hospitalization, especially for younger and healthier people. And I think, we all learn to live with a certain level of risk every day, and COVID is just going to be part of that. But I do think we're heading towards that.
Well, that's good to know. Thank you. And also, Damian, I actually really appreciate your point about the unsung heroes. I think I had forgotten how the grocery store workers just kept on moving and keeping us all fed and, with enough toilet paper and all that.
Yeah.
So I'd like to go to audience Q&A. And I think if there's a Q&A section that I'm looking at on Zoom, and Columbia admin, please let me know if I'm not looking at the right thing, but I will just go through some of the questions. Thank you. A question from Louise, and it says, I'd love to hear about how you were able to interview people who were initially hostile.
Yeah, it's a great question. And so I'm happy. I mean, we love talking craft, so we're happy to share a little bit. So one tactic in journalism, okay, it's not a trick, it's a tactic, is obviously Yasmeen and I had backgrounds in economics and health policy, so we had sources, right, who trusted us. And so when we, would do a ton of interviews and accumulate information, and as you can tell from the book, we would try to recreate scenes and find out what happened in specific meetings. And then we would go to people who, as Louise asked, were hostile and probably wanted nothing to do with us. But when they knew that we had 80% of a scene, that these people were in, 80% of an event, 80% of a decision that this person participated in, and that our book was going to have this person in that situation, that almost every time people felt like, well, I have to cooperate because I need to set the record straight, or I need to put my spin on that scene or my perspective. You can't go into someone cold and say, hey, I'm a reporter, tell me everything. But if you say, hey, listen, we know about this meeting on July 14th. It was in the situation room, it was 8 o'clock at night, you were wearing a red shirt, and they're like, okay, this person knows what happened. Then they're frequently going to cooperate. We also found, quite frankly, that after the inauguration, when Trump left, and as Yasmeen pointed out, the book was almost wrapping up, but a lot of people wanted to talk to us after that. When the Trump show was over, they all wanted to come in and try to not rewrite history, but give us their version of history. And so a lot of it,
rewriting it.
Yeah, exactly.
All right. Oh, sorry. All right, I have a question from a Dr. Harriet. I'm leaving off people's last names in case they want to remain somewhat anonymous. So Dr. Harriet asks, as a public health reporter, what comments do you have for how the pandemic exposes the state of the US public health system or lack thereof?
That's a great question. And I think we've actually been able to see a lot more of it with the Biden administration and the Trump administration, because for instance, the CDC story with the Trump administration was the White House's interference. And there was sort of this narrative that if it weren't for the White House, the CDC would be able to do a great job putting out science-based guidance, and if only the agency would be allowed to do its job. And then I think we found this year that there are actually, Biden came in and said, we're going to follow the science, we're not going to interfere, we're going to let them do their thing. And then we found very quickly that they kind of regretted that decision, that if you completely let the CDC do its own thing, it's going to kind of go off the reservation and take everyone off guard and not always make the best decision. And so the CDC is not the only entity to blame here. I think we found that all the health agencies and local and state public health departments have serious shortcomings, mostly due to chronic budget cuts and the fact that the US just never updated its health data systems, which sounds like a really boring, uninteresting topic, but was hugely important to the pandemic because it's meant that we've never had good data. We've never had a really good handle on how the virus is spreading or what variant is spreading. And I think that's become really clear in the last few weeks with the booster debate, because we're not really looking at US data for the booster debate. We're looking at Israeli data to decide whether or not these boosters should be authorized. So I think all of these things have exposed that the US just has fundamental structural shortcomings that would have been a huge issue for anyone. And there were a lot of stories last year about how bad the data was, how bad testing was. And the truth is that's not really specific to the Trump administration. That really would have been a problem no matter who was in office. No matter who was in office, the CDC would have made the same mistake on the test. That had nothing to do with Trump. The CDC was not equipped to deploy a test, to thousands of places across the United States. They really needed to take a different strategy from the beginning. There were going to be supply chain shortages because it was happening all over the world. So I think a lot of the problems with the pandemic were structural already. It was already going to be a huge challenge. And we've seen how outdated and behind our public health system is. The US was supposed to be the leader and supposed to be the best prepared for a pandemic. That has not happened at all. The US is constantly behind. Our data is constantly behind everyone else. We're looking at like Israel and the UK and Singapore and all these other countries for their data to understand what's happening here. And so I don't know that there are going to be serious lessons learned, but you have to do kind of unsexy things like investing in electronic health data and making sure that local and state public health departments are funded adequately so that they can report accurate data to the CDC. And maybe you need to think about serious reforms to the CDC. And I don't think that discussion is happening in a serious way yet.
Got it. All right. Another question from Samuel. I'm curious if you can speak to congressional action during the pandemic. How did a divided and perpetually gridlocked Congress manage to come together to enact sweeping COVID response packages like FFCRA and CARES so quickly and with such overwhelming bipartisan support? What, if any, role did the administration play in the passage of the relief bills?
Great question, Samuel. I would say, well, the CARES Act was the real big one that passed March 27th. And that was about a $2 trillion package, which, if you think of during the financial crisis, I think the TARP bill, the bank bailout was like 800 billion. So this is a $2 trillion bill. And when on March 27th, when this passed, I mean, the economy was crashing. There were 1 million people a day getting laid off. Which is, incredible to even wrap your head around. And the stock market had fallen 10,000 points and it was showing no signs of stopping. So this was a bill essentially to keep people alive. It was just to flood the economy with cash so that, hundreds of thousands of businesses didn't go bankrupt and that people had enough money to buy food because they had been laid off and they were stuck at home. And those bills passed. There were a couple of kind of political twists and turns, but for the most part, they passed, amazingly fast. And they did, get the money out quickly. And it did help a lot of people and a lot of businesses. Now, as the year went on, it got harder. And, even when President Trump was sick at Walter Reed in October, there was a big fight over, this additional round of stimulus checks. Actually, the president and the Democrats were kind of aligned in the desire to send out big stimulus checks, and other Republicans at the time, because they sensed that he was probably going to lose because his poll numbers were so bad. And they were reticent to do another expensive bill that they would have to kind of deal with in terms of the deficit and the debt, if he lost. So I think it got harder as time went on for that kind of bipartisanship to continue. But clearly, you know, in those initial months when there was so much to lose, Congress did move quickly, and the amount of spending that they approved is, you know, something we'll probably never see again. We hope we never see again, because we hope we don't live through something like that. But it just feels so different than what we're going through today, where everything is so partisan on the Hill. And even, you know, like, you know, typically it's kind of Democrats against Republicans. Now the Democrats can't even agree on their own kind of spending approach. So things are just much different, you know, 15 months later.
All right, thank you. There's another question from Chris. Have you visited the In America Remember exhibit on the National Mall? And it says, in comparison with New Zealand. If so, what thoughts went through your head?
I don't know about comparison to New Zealand. I mean, they've had very few deaths, but I have been to the one on the National Mall, and it's really overwhelming in the worst possible way. You know, each of the flags actually has the name of a victim on them, and their age, and sometimes it has a little bit more detail. So it's really important, I think, to see that and to walk through it, because the death toll from COVID is so massive that it's one of those numbers that you can't really comprehend. Like, what does it mean that 700,000 people died? It's like an entire state, but it's hard to comprehend what that means. And I think especially if you didn't have someone who you knew who died or got really sick, or you were really worried about. Everyone knows that COVID's been terrible, but I think it's different when it hits home more personally. And I think when you walk through that exhibit and realize each of those, I mean, the flags cover the entirety of the mall, and the mall's pretty big. You know, it's like walking through a massive graveyard. And I think you start to better understand what this has all meant. You know, there's a lot of families that have been broken apart irreparably because someone died, or the political divisions that this has all caused, or someone got really sick by someone else's recklessness. You know, there were a number of stories last year and this year. You see that all these stories this year, and they're so heartbreaking. I think people are getting to a point where they can't read them anymore, where someone declined to get the vaccine for a long time, and then they finally made an appointment, they finally decided it was time, and they died waiting for their appointment, or they died between doses, or pregnant women who, you know, believe these conspiracy theories that it can affect fertility or affect their baby, which is not an invalid concern, given that the vaccines haven't been around for a long time, and then they die before they give birth, or, you know. And I think there is a bit of empathy fatigue on that, but, you know, it's the reality right now. Like, the pandemic is still killing 1,000 people a day. Most of them are unvaccinated, but, you know, last year, most of the people who died, like Damian said, were like grocery store workers or frontline workers, or people doctors and nurses. I mean, there was like a devastating toll of doctors and nurses who were going into ERs every day trying to treat patients. And I think it's important for all of us I think it's easy to put this in the rear view mirror if you haven't been affected in that way, because we all want to move on. This has been such a terrible 20 months, and people want to feel some sense of normalcy, but it's important to take stock of what it's meant for so many people.
So while we were experiencing COVID, we were also going through an election cycle. Did you find that some people were more forthcoming with you maybe after the election versus before, or no?
Definitely. And I think one of the reasons our book is titled Nightmare Scenario is because this all happened during an election. And, you know, I think when it was clear when it was clear to the people inside the White House after January 6th that President Trump was leaving, and that it was over. You know, quite frankly, a lot of the people in the White House knew he lost, but, you know, didn't want to say anything because he would be enraged. But when it was clear to him that it was over, I think a number of people felt like they needed to participate in our book for almost like therapy reasons. You know, they knew we were going to write first fulsome account of what happened. and they wanted to participate. They wanted to almost give their side of the story. Not a single person we talked to defended what happened. Not a single person who was asked response thought it was a good response. People defended their own behavior and kind of would point fingers at someone else, but no one would say, okay, next time there's a pandemic, we're going to do it just like this. It's going to be fine. But they felt like they needed to explain why they made the decisions they did. And, Yasmeen and I did everything we could to listen, to try to understand, to try to see how things fit together. You can see kind of in the fog of war how people might have made mistakes that were well-intentioned, but at the same time, we can see how so many mistakes were driven by, jealousy and selfishness and childishness. So I think that, what the politics, I think, made people kind of blinded, through 2020. But when the dust settled, I think it made it a little bit easier for us to try to get the full account from people, whether it was true or not. We had to sort of reconcile that ourselves, but it made it easier for us to get access to them.
Interesting. So no one actually sat there and said they regretted their actions.
There were I think there were 2 people who, of 180, who said that they regretted something they did, but it was mostly defensiveness over the decisions they made and why they didn't really have another choice. I think a lot of people are struggling to reconcile with their role.
Yeah, understandable. All right, a question from David. Did you come across any Trump administration officials who felt pressure not to wear masks in public and resented those pressures?
We did. We found out that Trump acted, like when people were in the Oval Office, that if someone came in wearing a mask, and it would mostly be various health officials, he would ask them to take it off, and he told them they looked ridiculous wearing it and that they couldn't. And he actually told people if they were going to do a press conference with him, they could not be wearing a mask. And there was one person who said, I have to wear a mask if I'm in public. I have to set that example. And the president said no, and they cut that person from the press conference. That was how much he disdained masks. And I think people were really frustrated by the mask debate because you even saw Trump's former campaign manager saying after the election, he felt like Trump would have won if he would have just shown a little bit of empathy. And if he, would have taken it a bit more seriously, because even though some of Trump's supporters were listening and hanging to his every word, a lot of them were hurting pretty bad from this, whether economically or their family members dying. So I think with the mask debate, there was a lot of frustration in general. There were people who held the same beliefs as the president and felt like they shouldn't force people to wear them. But I think there were a lot of people, especially by the summer, who felt like this was such an easy political win for them and it was a no-brainer and they weren't using it.
Just to follow on that, we have a question from an anonymous attendee that says, do you think Trump could convince a significant percent of anti-vaxxers to convert?
To become vaxxers? Yeah, it's interesting. I am still not convinced he's been vaccinated. I thought it was interesting that there's no evidence that he was vaccinated. There's no photograph. There's no, quite frankly, the dates don't quite line up. So I think that if he would have been vaccinated on camera, I'm not saying he's not, I'm just saying I would have loved to have seen it.
Right.
Because I think if we had seen him be vaccinated, I think a lot of his supporters would have vaccinated too and felt like it was something that was safe and that they could do because the person that they really admire got vaccinated. I think it would have been tremendously beneficial to the response. So I do think that if he had done something like a public event where he kind of embraced vaccinations or went to a vaccination site and kind of talked to the doctors and nurses, I think it might have had a really powerful impact. But I think that window's kind of closed now.
Yes. Another question, what happened to the Obama era preparation of a US/global pandemic plan that Dr. Fauci and others helped create to provide a starting point on how to combat something extraordinary like COVID? Was the plan, quote unquote, dusted off and looked at by Fauci, Birx, and others back in January or February of 2020?
No, they didn't use the plan. I think a bit too much has been made of that plan, though. It's good in theory, and we wrote this in the book, that there were plenty of like white papers and policy papers about what you do in a pandemic. But the truth is that COVID kind of threw all of it out the window, especially because it could spread asymptomatically, which was a real game changer, and these plans had not taken into account. So they didn't use the pandemic plan, but I don't know that that would have really made a huge difference in this case. It would have been a good starting point, but I think the initial sin was that it took them a long time to appreciate how serious the virus was. And that was for a number of reasons, including that through all of January, there was not really good information coming out of China. It was really conflicting. They couldn't get a sample of the virus. China played down the role of person-to-person spread for a couple of weeks. So people, and then it seemed like it was, and then they were taking these really drastic actions that didn't line up with what they were saying about what they understood about the virus. And then in February, even when it became clear that it did spread person to person, and the Chinese health minister had said, I think on January 28th, that there was evidence of asymptomatic spread, there were a lot of people who didn't really believe that at the time, because they were like, no previous coronavirus has done that. And I think if that had been appreciated earlier, you would have seen really different testing guidelines. The testing guidelines through the end of February were to test people with either recent travel to China or who would come into direct contact with a confirmed case, which really didn't make sense for how the virus was spreading. Mm-hmm. So I'm not convinced that that pandemic plan would have made a big difference here, because I think this virus was not the type of virus anyone had really prepared for. It was a lot of planning for a pandemic flu, which is applicable, but is not the same thing. And this virus was much more vexing than that.
Okay, another question from someone anonymous. Given where we are today regarding COVID, how do you think this will affect the outcome of the midterm elections? If you were on the Biden team, what would be your public relations, marketing messages / tactics regarding COVID when approaching the midterms?
That's a really interesting question. Quite frankly, so the midterms are a little more than a year away. And, obviously, if we're still wearing masks like we are now, and COVID is still killing 1,500 people a day, I think President Biden's in big trouble in the midterms. I personally think that the situation should look much different in terms of COVID by next fall. I think that this Delta variant could be the final, terrifying throes of the virus. I think it's going to stick around, but I think this variant should hopefully burn off by then. And that we could be in a situation where kids are in school without masks, and almost all kids have been vaccinated, and we're kind of living with this. Now, there's other things that the virus has, created a mess up with, mostly in the economy, the supply chain problems and inflation and stuff, that actually could be an issue for Biden in the midterms. But in terms of the virus itself, I think that we could be in a much different situation, and whether voters give the Democrats credit for that or not, I don't know. But I think, if the virus is not receded, then the Democrats are in a lot of trouble.
All right. A question from Ruby. How comfortable are you with the statistics that have been published, given the craziness you have described occurring within the administration?
Not at all comfortable. But I don't think it's specific to the Trump administration. I think the data problems are the data problems, and that would have been true no matter who was president, because we see it continuing. Like I'd mentioned earlier with the booster debate, we just don't have good data on it. And one of the most frustrating stories for me to cover this year was over the summer. The Biden administration was insisting until the end of July that breakthrough infections were exceedingly rare. They kept saying, the CDC says it's exceedingly rare. 97% of people getting infected right now are unvaccinated. So it seemed, but people were hearing anecdotally that vaccinated people were getting infected, and it was like a friend or a cousin or a sibling. It didn't seem that rare. And then of course, you know, by the last week of July, we found out that it's not rare at all, that it's happening at quite a large pace. And that's because we weren't really tracking breakthrough infections. We didn't have a good grip on how the virus was spreading. We didn't have a good grip on that it was the Delta variant that was ripping through the US. So I think the data problems are independent of any administration. And I think the US has a serious data problem that if they want to do a better job in the next pandemic, needs to be addressed. And it's like a 2 to 3 year project. It's not like a single congressional bill type of fix.
Thank you. We are getting close to the end. I have a couple more questions. Thank you for being so generous with your time. One from Stephen. Was the incompetence, if not actual malevolence, with respect to COVID even worse than the similar problems with respect to AIDS?
That's an interesting question. Yasmeen, you want to start on that one?
Yeah, that's a really good question. I think they were similar in a lot of ways, in that the government was unwilling to acknowledge the problem and the issue, but I think there are some really important differences. AIDS is a pretty slow moving virus. So it's, you know, I think it took less than a year to get to the death toll for COVID that it took over a decade in AIDS. So there are important differences, because when people get infected with HIV, they don't necessarily die immediately. It sort of takes, so I think the AIDS crisis was almost like approaching an iceberg, but there were important similarities. You know, Deborah Birx, when she came in, one of the big things that she wanted to address was who was being tested, because she felt like, as they did with HIV/AIDS in the 80s, they were only testing symptomatic people, and they were missing a ton of asymptomatic people who had the virus and were spreading it. But I think, you know, COVID also affected everyone. It wasn't confined to a specific segment of the population. And AIDS was and continues to be global, but I think just the swiftness with which COVID moved meant that you couldn't ignore it in the same way that I think the Reagan administration ignored AIDS for a number of years.
Okay, so 2 more questions and then we will let you go be with your families. I guess speaking of testing, this question comes from an anonymous attendee, and it says, was the lack of a national testing strategy the result of conflicting power bases? I think you did talk to that a bit. Or because the president was hostile to testing because it made his numbers, quote unquote, look bad? Or did both issues contribute?
Yeah, C, both issues contributed. I mean, so like, just to back up, I mean, they got it wrong initially. There was no one really in charge of it. Jared Kushner did kind of swoop in March to act like there was a national testing strategy. But then, as we make clear in the book, President Trump told Alex Azar, we're not doing the testing. The states are doing the testing. If we are responsible for the testing, it's, you know, we are on the hook. And so he made clear to them, to his aides, that he did not want the federal government to play like a leadership role in that. And then I think we all saw, as the year went on, he said things like, you know, whether he was joking or not, I tell people, no more tests, no more tests. The numbers are making me look bad. And, you know, if there's no testing, then there's no confirmed cases. I mean, it was kind of an insane, mentality, kind of like see no evil, hear no evil. And so I think to have negative pushback, I believe now we're still having problems with tests. There just wasn't a lot of aggressive investment in getting mass testing available, because, you know, as I said, you can't know the scope of the problem if you don't know who's sick. And it's kind of amazing at this point, they miraculously developed 3 vaccines, thank God. But the fact that the testing stuff is still such a mess, I think, is one of the biggest tragedies of the whole thing.
All right. Last question. Was the Obama administration remiss in not adequately replacing PPE and ventilators following the H1N1 virus spread?
That's a good question. I mean, I think it's a lot of people are Monday morning quarterbacking this, and but that was obviously an oversight. When COVID hit, it became clear that the supply of N95s had not been replenished since 2009. So a lot of the masks that were in there were expired and not usable. And then obviously the US doesn't have a good enough domestic supply chain to be able to, massively ramp up and produce enough masks and gowns and other equipment for the country itself. So I think the problem with the national stockpile was across several administrations. You had in the Trump administration that they also focused on procuring like anthrax vaccines and smallpox vaccines. They focused on these things that they thought were, they were preparing more for a biological or nuclear attack and not so much a natural, pandemic event. And their thought was, the vaccines are so much harder to get on a moment's notice. We can get masks and gowns and gloves if we need to. It's not nearly as hard to produce. We can't like produce an anthrax vaccine out of nothing. So I think it was just a lot of preparing for the wrong event or taking for granted that things were going to be okay. I think one of the things that's important to remember about H1N1 is they thought it was going to be a lot worse than it ended up being. So there had been a number of instances where the US had kind of lucked out and a virus had not been as bad as projected. It was the same thing with SARS and MERS. Like it didn't end up being as bad in the US as people feared. And I think the Asian countries, especially that you saw do really well in the pandemic and that were really prepared, had really bad experiences with SARS and really bad experiences with MERS and wanted to make sure that it never happened again.
All right, last question. Someone asked whether you think Dr. Fauci should be Times Man of the Year.
No, I mean, I just think that's kind of silly. First of all, no one cares about Times Man of the Year except for Donald Trump. It's not even, I haven't seen a Time magazine in 30 years. I mean, I keep going back to the real heroes of this are the people whose names we don't know, the people who, so many people lost their lives. My great aunt died of COVID in a nursing home, the virus mowed down her floor. I mean, there's so many people who, quite frankly, books should be written about, who are anonymous and they're flags on that lawn, but we should be kind of honoring. I think Fauci's going to get his recognition, he's going to get his scrutiny, and he's going to have books written about just him, and we'll all kind of make up our minds about him. And Yasmeen and I did everything we could to kind of bring him to life and hold him accountable. But I think something like Man of the Year, maybe it wouldn't be the best fit.
He already has a bobblehead.
Exactly.
Yasmeen, do you have any final thoughts
on that question, or just generally?
In general.
I agree with Damian on that question. I don't think that's good for anyone, but including Fauci. But no, I'm really grateful that we got to talk about this. I think I guess my biggest hope after I've covered nothing else but COVID since January 2020, and I think my biggest fear is that once things start to get better, everyone's ready to move on, and there's not really there's no 9/11 style commission looking at the pandemic response across both administrations, which to me is insane because 3,000 people died on 9/11 and a new agency was created because of it. And, so many changes to the country's national security apparatus. 700,000 people have died, untold millions have been infected, almost 50 million that we know of. And the idea of that not being investigated, of people not being subpoenaed to understand what happened and how decisions were made and why, and to understand how this happened and to make sure it never happens again and that proper investments and changes are made, I think would be devastating and, wouldn't be fair to the people who lost their lives or livelihoods in all of this. So I just hope that there is a point at which people want to learn from this and make sure that it doesn't happen again.
Well, thank you both so much. I know you are sought after and accomplished, and I truly appreciate, I know I speak for everyone here when I say I truly appreciate your time this evening. I very much enjoyed speaking with you and learning from you, and I hope we will have the chance to talk again when you write your next book.
Thank you, Laura. It's been been such an honor to be here with you.
Oh, thank you. Thank you. So we will have a record, just for a little bit of housekeeping, we will have a recording of this program, and we will send the link out in a day or so for anyone who missed it or would like to relive it. But anyway, thank you so much for a wonderful evening. I wish you all the best of health and happiness.
Thank you.
Thank you.
Thank you. Bye-bye.